my name is Serena Patton. Today I'm going to perform tracheotomy care. I have my supply here, the hydrogen peroxide, alcohol gel for cleaning, sterile normal saline, trach kit, I have tape and pre-cut tape, one pair of clean gloves. I have my patient with trach. So first I'm going to check the physician order, and then I'm going to gather my supply, going to my patient's room, knock the door, open and close the door to provide privacy. I'm going to put down my supply on the bedside table, perform hand hygiene. Hi, my name is Serena. I am your nurse today. Can you tell me your name and date of birth, please? All right, thank you. So the patient tell me his name and date of birth, and I check against the armband. So his two identifier has been verified. So the doctor has prescribed the tracheotomy care, which I'm going to remove the old dressing, remove the cannula to clean it out and replace it back in. Once it's clean, I'm gonna put the new sterile dressing in and change the tie. Is that all right? Thank you for your consent. And do you have any questions, any allergy? None of those? Okay, so the patient that gave me the consent to do the procedure after I explain how to do the procedure to him. So next I'm going to assess your cardiopulmonary, which I'm going to check your vital signs. I'm gonna check your heart rate and oxygen. I'm gonna have you hold on this oximeter the whole time, remain throughout the procedure. Is that all right? Thank you. So next, I'm going to pre-oxygenate your for 30 seconds, and I'm gonna ask you to deep breathe in and out. Okay, and I'm going to perform suctioning as needed. Do you have any questions? No? Okay, I'm gonna raise the bed up to the working height level for me, and I'm gonna raise the head of the patient to the semi-faller or faller position. Perform my hand hygiene. Put on clean gloves. I'm gonna remove this old dressing, okay? If anytime you have pain, discomfort, please let me know. Raise your hand. I'm gonna discard the dressing with the clean glove. Discard it. Perform hand hygiene. Doing okay? Alrighty. So I'm gonna open the trach kit. Make sure I'm open away from my body. Okay. I'm gonna remove the sterile gloves. Remove the sterile drape. And I'm gonna make sure I touch only the shiny side of the drape. And I'm gonna create the sterile field. I'm gonna dump this supply into the center of the drape. Gonna pour the sterile normal saline into the container, and I'm gonna pour the hydrogen peroxide into the container. Perform hand hygiene again. Gonna put on sterile glove. Gonna make sure I touch only the outside of the wrapper, and only 1 inch. Make sure the paper is. Perform hand hygiene again. I'm gonna slowly put the sterile glove on, so that it's not, the cuff doesn't fold and roll. Okay. This as well. Perfect. Discard the paper. Gonna organize my supply. Put in the normal saline and cleaning solution. So I'm going, this is my clean hand, this is my dirty hand. I'm gonna unlock and remove the cannula, follow the curvature of the trach. Okay, you doing okay still? Put in the soaking cleaning solution. And I'm gonna use my clean hand to grab the brush to clean the cannula, get all the secretion, cleaning it out, and put in the soaking soaking normal saline and discard the brush. Once it's soaking in the normal saline, I'm going to grab it out and make sure it's dry. Once it's dry, I'm gonna replace back in the trach tube, and also I'm gonna replace in as a natural curvature of the trach and lock it in place. And I'm going to use the Q-tip to clean the skin around the stoma. I'm gonna keep my hands above the waist at all time. Okay, cleaning all the secretion, the dry secretion. Okay, the skin around it, the skin around stoma. Okay, next I'm going to pat dry. Okay, and this is a good time to inspect the patient stoma and skin to see if it's any sign of infection or skin integrity. So I don't see any sign of infection or breakdown skin. It's look good. So I'm gonna do the next procedure, which is the changing tie. This procedure is 2 people procedure, which I need another person to assist me so that one person can change the tie and another person can keep the trach in place and make sure it's secure. So for this video, it's only me, so I'm gonna do my best to secure the trach and also change the tie, okay? Okay, now I'm gonna use one strip method. I'm gonna pull this tie over the back of the neck and make sure there's no fold or no twist ties that can cause the future skin problem. Okay, going to tie and make sure that there's 2 fingers fit, which is a 2 finger fit. Okay. Still 2-finger fit. Perfect. I'm gonna use this 4x4 to cover the knot, and we can cut the excess length of tie. Okay, so I'm gonna use this gauze to cover the knot area so that the knot won't touch the skin and cause a skin breakdown. Also, I'm gonna use tape to secure the gauze in place and make sure that the tape doesn't touch the patient's skin as well. And this is the sterile dressing that I'm going to put in place. Okay. All right. So I'm going to clean up my stuff. Take off my sterile glove. Discard it. And perform hand hygiene. I'm going to step outside and, oh, hold on. I'm gonna bring the bed down to the lowest position. Here is the call light. Do you want me bring your head down or up? No, you're in a good position. Alrighty, thank you. If you have any concerns, you need to move the head up and down, please give me a call, okay? I will step out and documenting the procedure today. Thank you.